Hi everybody, this is Dr. Fouladian and we're going to start chapter 7, that is the skeletal system regarding the appendicular division. So we already have talked about the axial skeleton in the chapter 6. Now we're going to talk about the appendicular skeleton. Appendicular skeleton includes the pectoral girdle that includes the shoulder bones and also the upper limb. So that's related to the upper extremity. Upper limb, sometimes they call it free upper limbs or just upper limb or upper extremities. And the pectoral girdle is the part, the shoulder, that attach the free part of upper limb to the axial skeleton. Then we have pelvic girdle, that is the hip bones. We have one hip bone on each side when they are connecting to the axial skeleton, and the lower limb or free lower limbs or lower extremities, it may be called in any. So here in this picture, you see the appendicular skeleton part that in general makes 126 bones. You see the pectoral girdle that made up of 4 bones totally from both sides. Upper limbs or 3 upper limbs, 60 bones. Pelvic girdle, 2 bones, and the lower limbs, 60 bones. So here you see that the pectoral girdle has 2 bones, 1 on each side. So total of the 4 bones. Clavicle and the scapula. Just after this slide, we're going to talk about every one of these bones. And then the upper limb includes the humerus. Then we have the humerus and ulna on the forearm. We have the carpal bone in the wrist. Then we have metacarpal bones here. And then we have the phalanges in the digits. For the lower limb, we have pelvic girdle that we have one hip bone on each side when they are connecting to the sacrum. Sacrum is part of the axial skeleton here, and these hip bones are connecting to that one. And on the front, these two hip bones are connected to each other here. Then we have the one single bone of the thigh, that is the biggest bone of the body, femur. We have 2 bones in the leg, that we have tibia, the big one, fibula, the smaller one. And then we have in the ankle, we have tarsal bones, they are 14 bones, 7 on each side. Then we have metatarsal bones, and then finally we have phalanges again in the digits. So these are the parts that we are going to talk about each one by one, but it's good to see them here while they are over the body to orient yourself with the location of each one of them, how they are connecting, and all those parts. And it's good to get back to this picture as it is like a skeleton in the lab. So you can get, after each bone, get back here and practice on them too. So for the pectoral girdle, that consists of the clavicle and scapula. Starting from the clavicle, I have the bone here, and I like to show you. So clavicle, sometimes we call it collarbone, as just is located here over the body. It has 2 ends. One end is the side that is connecting to the sternum here, and on the other end it is attaching to the scapula. Scapula is a bone that we have on the upper back and makes the back of the shoulder here. So it has a process, the scapula has a process, we call it acromion. So one end of the clavicle is attaching to that end is called acromial end. These 2 are the ones that you need to recognize from each other. Which one is a sternal end, that obviously is on the medial side, which one is on the acromial end, as obviously on the lateral side, because the acromion is coming from the posterior part on the lateral, and the clavicle is going to attach on that on the lateral side. So to differentiate these ones, if I show you here, you see that one end of the clavicle, it has a bigger surface area, and if you look at that, that's the shape that it has. It is like a patch, like here, right? This is the external end that is going to attach to the sternum, in other words, medial end. If you look at the other end, you don't see that like that. This is not as big as the external end. It is kind of flat though. It is wide here, but it is not thick, right? So this one is the lateral end that is going to attach to the acromion. So that's the way that you recognize it. Then it has a conoid tubercle. Sometimes they call it conoid process here. And this is the one to recognize because it helps you a lot to recognize that the bone is located on the right side or on the left side. For the appendicular skeleton, there are a few of the bones that you may find it over your lab handout that you need to recognize them. Are they located in the right side of the body or over the left side of the body? And to get to those ones, so those are not for all the bones, just I believe 6 of the bones that you need to know. And clavicle is one of them. So regarding that one, you need to recognize anatomical directions, right? You remember directional term? Which side is superior, which side is inferior? When you want to put something in the space to see that it belongs to the right side or to the left side, you need to know which one is the superior side, which one is inferior side. Then you need to know which side is medial, which side is lateral, and the same way, which side is anterior, which side is posterior. So for each one of these directions, like for each pair of these directions, you need one landmark to be very obvious, very clear, and something that is not mistaken with anything else, right? Like you need, in general, 3 landmarks, one for the superior and inferior, one for the medial and lateral, and one for the anterior and posterior. But it happens sometimes that one landmark can serve for 2 of them, or even sometimes one landmark can serve for 3 of them. So that's the case for the clavicle and the conoid tubercle. So as you see here, conoid tubercle is near the acromial end. So that side, you remember, that's the flat one, wide and flat. And we have costal tuberosity that is near the sternal end. Now consider this conoid tubercle. If you look at this picture, now you know that this is the sternal end, and on the medial side, this is the acromial end on the lateral side. And this is the superior view. As you look, you see that you don't see much of the stuff on the superior view. Compared to the inferior view that you're looking here, again, you have the sternal end and the acromial end. But you see that you have a groove here, as you see. On the side of the sternal end, you have the costal tuberosity, and on the side of the acromial end, you have conoid tubercle. So if you look at here, this was the acromial end, right? So near that, you have on the inferior side, that you see that you have a groove here. You may not see here on this very well. It depends on how well you see this bone, but at least you can see the whole picture here. On the side of the acromial and near to that, on the inferior side that you have a groove, you have the conoid tubercle. So sometimes they call it conoid process. So that's the same here. And on the other end, you have the costal tuberosity. This conoid tubercle is a good landmark that you can use it to recognize for all three directions of the bone. I call that one as a LIP, lip, LIP. L for lateral, as you see, is on the side of the acromial end. So this bone, that is the conoid tubercle, I put my hand right over that so that you don't lose it, is on the lateral side. So this lateral might be on this side, might be on this side, right? And also it is inferior, lip, lateral, inferior. So I should keep it the way that it be on the inferior side. It's still lateral and inferior. Again, might be this side and it might be this side, right? So the only direction that determines which one is that which one is anterior, which one is posterior. But conoid tubercle is lip, is lateral, inferior, posterior. So this should be on the posterior side. This is the conoid tubercle. So if I keep it in this position, now this is on the lateral side, on the inferior side, and on the posterior side. But if I keep it in this position, it is lateral, inferior, but it's on the anterior, so this is not correct. This bone doesn't belong to this side of the body. This belongs to this side of the body, to my right side, right? And you can do the same for all the other bones that we are going to talk about them, and we talk about the landmarks that they have. So I'm not going to repeat these ones for every one of them. I may go over a few things, but not for all the things that you need to recognize right from left. You do the same for yourself to recognize it. Just compare it for your own right and left, for your own anterior and posterior, for your own superior and inferior. And then decide, okay, considering all those three landmarks that you should find on a bone, that belongs to the right side or the left side. You see, this bone belongs to the right side, right? So that was the recognizing how do you recognize a bone regarding the right and left. So that was regarding the clavicle. Now the next bone is scapula. The scapula is a special bone because it has a very specific behavior. Like you see, it's an irregular bone. It's not. It has different parts, different angles and processes. So in the body, it is located the way that if I keep it on my posterior part of the body, it will be like this. So in this position, if I keep it here and bring it here, you see that the anterior surface is this one. So anterior view of that is this one, and then posterior view is the one that it has this part that we call it a spine. We call this one a scapular spine, right? This scapular spine divides the posterior part to two parts. One part is above that, superior to that, and it is a cavity, right? So we call it a fossa. And it is superior to this spine, we call it supraspinous fossa. And the whole this cavity that is inferior to the spine, we call it infraspinous fossa, right? Now pay attention. This spine is important and it's very obvious to see that. You won't miss this part, right? If you continue this spine, you get to the process that we call it acromion. This is the one that was going to attach to the lateral side of a clavicle like this, with the acromial end of the clavicle, right? So this is the way that these two are attaching to each other. So this is the acromion. So please never ever mistake this one with the other process. This is acromion. How you recognize it? That's at the end of the spine of the scalp. So that is the posterior view. On the anterior view, you have the whole body here, and then you have a process here on the anterior side here that you call it coracoid process. Coracoid process. Later you will see that many of the muscles are attaching to this coracoid process. Then here you have one complete fossa tube, right? It's a depression, a shallow depression. We call it fossa, and we call it subscapular fossa, as if that from outside of the back you're getting inside and you have the bone, and this is under that, right? Although it is the anterior side, right? So we call it subscapular fossa. Over the body, when we go over the cadaver, we see that if we're on the back, we push this one up and look into that. In this fossa, subscapular fossa, you have a muscle that is attached to the bone. We call that muscle as subscapularis. Later we will talk about the muscles. Don't be worried about them now, but just as you are here, that's easier to learn them and remember them later. So you have a muscle subscapularis here, the same way you have a muscle here in the infraspinous fossa, you call it infraspinatus. And you have a muscle in the supraspinous fossa, we call it supraspinatus. So the other things that you need to know, again for the scapula, that you need to know medial from lateral, superior from inferior, anterior from posterior. We already talked about the anterior and posterior. This one that has only one fossa is anterior. The other side, it has the spine, is posterior, right? What about the medial and lateral? So if you have a bone, this is the shoulder bone. Scapula is the one that the upper limb, the arm, is going to attach to. The bone that we have for the arm is this one, that is called humerus, right? One single bone we have in the arm. And this is the place that is going to attach to the shoulder. The place that they are making a joint in this area here. You see this surface of the scapula is called glenoid cavity or glenoid fossa. This is the one that is attaching to this part of the humerus and make the joint, the big shoulder joints, right? Although it is supposed with so many ligaments around that, right? But this is the main joint, humeroglenoid, right? Between the humerus, this bone is humerus, and this area is glenoid. So we call this joint humeroglenoid or shoulder joint, right? So if you look at this, which side is medial, which side is lateral? Do you think which side of the body your humerus can stand? It should be in the medial side of the body or the lateral side of the body? Obviously, lateral side of the body. Your two humerus cannot be in the middle of your body. It should be outside, right? So the same is for the scapula. This side of the scapula, this glenoid fossa, cannot be on the medial side. It's always on the lateral side, no matter is this side of the body or this side of the body, right? So this is a very good landmark that is always on the lateral side. So we use this one to decide about the medial and lateral. This is on the lateral side, so therefore the other side is on the medial side. So on the lateral side that we have a glenoid, we have a border here, we call it lateral border. Therefore, on the other side, we have a border, we call it medial border, right? So this is close to the midline. That is the one when you bring your shoulder back, these blades are getting close to each other. So we talked about this in the lateral view, the ones that we have glenoid cavity, we have the lateral border, also we have the lateral angle here, and we have the glenohumeral joint, the joint that is going to make here. We have the neck that is right here, this part. We have the acromioclavicular joint as I showed you, and we have supraglenoid tubercle, this part that acts like a tubercle, and infraglenoid, sorry, for the glenoid. We have a tubercle here, supraglenoid, superior to the glenoid, one inferior to the glenoid, infraglenoid tubercle. Now, besides the medial and lateral, now you know that this is lateral. It might be this part and or might be this part that you already know, superior, and you already know and anterior and posterior, but first you need to know superior and inferior too. But you, as you have seen this one, now you know that which side is superior. This side that is like a triangle, one corner of the triangle is inferior angle, so it's located toward the inferior, and this side that it has all these things out, that is superior. You see that you have the coronary process, you have a notch here that we call it suprascapular notch here, this notch that is here, and this is the superior border, and you have the superior angle here. So by this one, now you can easily say which side of the body this belongs to, right? This is on the lateral side, might be here, might be here, but, and this is superior, this is inferior, right? Now, can it be here? No, because this is the posterior. This should be toward the posterior. Now you have the anterior, superior, and also, so you have superior and inferior, you have anterior and posterior, and you have medial and lateral. So this belongs to the left side of the body. So as you see all those parts here in this picture, I already have shown you all. So that was regarding the pectoral girdle that included the clavicle and scapula. Make sure that you realize all those parts in the bone in the back. Now for the upper limb or pre-upper limb, it starts with the humerus, that is this bone. So one thing that first of all you need to recognize the bones from each other. Just name the bone. If I ask you in the lab, name the bone, or in the lecture or anywhere, just naming the bone, you need to have some landmarks to recognize the bones from another bone, right? So this is the humerus. Then later I will show you the two bones of the forearm. Let us see here, we have ulna and radius. Then we have the carpal bones, the bones that we have for the wrist. We have 8 bones for the carpal area. We call them, all of them, carpal bones. And then we have metacarpal bones that are located between the wrist and the digits in this area. We have 5 of them. We call each one a metacarpal bone. And finally, we have phalanges. Each digit, means finger, has 3 phalanges, except the thumb that has 2 phalanges. Pay attention that we call the fingers and toes, both of them, as digits. And we call each part of them as the phalanges, or sometimes they call it phalanxes. They are the same and both are acceptable. And also that one is the same for the hand and for the foot. So pay attention to difference between the anatomical term and the Latin words with the English. So as you see, all the pectoral girdle, scapula, and the clavicle on the other side. You're looking at the is actually not a good picture because it seems has been rotated, because it seems this is anterior view, but we don't see it clavicle. It should be on this side. Anyhow, the upper limb, this is the humerus, and this is the radius on the lateral side, ulna on the medial side. From now, learn that radius is always on the lateral. Radius is on the side of the thumb. This is thumb that has only, this is the metacarp. After that, it has 2 phalanges compared to the other ones that all have 3 phalanges, and that's the way that you recognize the thumb. And radius is always on the side of the thumb, that is on the lateral side of the body. You remember, in the anatomical position, your thumb is always toward the lateral because your hand is facing forward. The palm of your hand in anatomical position is next to you, down and facing forward. So in that position, your thumb is always lateral. Therefore, radius is all in anatomical position is always lateral. So here you see the carpal bones, the 8 small little carpal bones. Then you have the metacarpal. Meta means between, right? Between the carpal and phalanges here. And then you have the phalanges. For the phalanges, they come in the rows, right? Like these ones have 3 phalanges, these 4 fingers, and the thumb has 2 phalanges, right? So we call them as the proximal row, middle row, and distal row, right? The way that we can differentiate them from each other. The thumb has only proximal and distal. The other one have proximal, middle, and distal phalanges. So going over these ones one by one. For the upper limb, that starts from the humerus. So the first thing, this is one other bone that you need to know about the orientation. Is this toward the right side, for the right side of the body, or it's from the left side of the body, right? Again, the things that you need to know, which side is superior, which side is inferior. I already have shown you that one part of this bone is going to take part in the shoulder joint. So if you remember, you can tell me which side it is. Is it this side or this side? That's this side, right? Do you see this shiny surface that you have, round shiny surface? It shows that it's going to take part in a joint. And as we had the glenoid cavity of the scapula is going to make a joint here, right now. So tell me, is it superior or not? This is superior because it should be close to the shoulder, cannot be otherwise, right? At the same time, can you tell me about the medial and lateral? Can you recognize which part of this bone should be medial or lateral? We can use the same analogy that we used for the shoulder as a joint. A joint between the scapula and the humerus should be toward the outside of the body, not in the middle, right? The same way, the joint that the humerus, that is outside, is going to make with the scapula, this side of humerus that taking part in the joint cannot be toward the outside, right? What is going to be connected to outside? There is nothing there. Whatever it is, the scapula is in the medial to this one. So this one has to be located like this to be connected to the scapula. The same way, even if it is here. Again, this side, this shiny joint surface should be toward the medial to make a joint with the body, with the center of the body, right? So the same landmark, that is actually the head, is toward the medial too. So this is superior and this head is toward the medial, right? So far you know that this can be like this or it can be like this. Both of them can be true, right? The things that differentiate that is which side is anterior, which side is posterior. That we will get to that one after we talk about a little bit more of them. So the other things that we have over this superior part, if you look at here, you see that after the head you have a neck here, the neck part here. That's the anatomical neck of the humerus. But humerus has a surgical neck too. The surgical neck is part of the humerus that if any blow happens to the bone, usually the bone breaks on that part, not the actual anatomical term that is located here. So this upper part and this lower part would separate in the surgical neck, and that's the one is usually needs surgery because it cannot be fixed and kept together without the surgery. Therefore, we call it surgical neck. So that was regarding that one. And now when you look at here, you see that you have two projections and they are like a tough surface or the rough surface, whatever you call it, is not a smooth area. Therefore, we call it tubercle, right? You have one bigger one here, we call it greater tubercle. One smaller one here, we call it lesser tubercle. And if you look into that, between these two, you see a groove, right? This groove is called intertubercular groove. So that's inter means between, right? Means between the two tubercle. And we call a shallow groove as the sulcus. So we call this one intertubercular sulcus. Later you see that a tendon of a muscle is going to pass through this area, and this is like making a secure place for that so that it doesn't move from here. Then we have the main part of the bone that we call it the shaft here. Then we have a deltoid tuberosity, that is a line that you see that here that's like a spiral line that we call it deltoid tuberosity, that the muscle, big muscle that we call it deltoid is going to attach to that. Tuberosity is a rough surface over the bone. Tubercle, tuberosity, those are all rough surfaces, just they are different in the size, if it is a small or bigger, right? But we need a rough surface over the surface of the bone whenever a muscle is going to attach to the bone. Otherwise, the attachment won't be strong. If it is a smooth, shiny surface, the muscle can be detached, right? On the other hand, whenever we need one part of the bone take part in a joint, we have a shiny, smooth surface like this one. We don't want a joint be rough, right? We want a smooth surface so that facilitate the movement, decrease the friction, and all those ones, right? So that was regarding the proximal end, all the structures that we have here. As you already know, this is the upper part, so this is the proximal part, right? That is closer to the center, closer to the shoulder, closer to the point of attachment, right? Now we go to the other end. This is the distal part, right here. On this distal part, if you look at that closely, you see that it is totally different from the proximal part. This distal part is the part that we use to recognize that which side of the bone is anterior, which side is posterior. So if you just look at that from this side and this side, if I bring the two bones that we have, this is the ulna. As you see, this C shape of the ulna is very clear, like a tiger or like a snake that is going to swallow a big thing like this, right? So don't mistake this one with any other bone. This C shape is very typical, right? This is ulna, right? And we have another one that we call it radius. Radius is also typical because of this part of that if you look, you see like a disc here, right, in this upper part. So let me have these ones in my hand and see how this arm bone, that is humerus, is going to connect to one of these forearm bone, that is the ulna, right? They are going to make a joint here, right? And the way that they are attaching is like this, right? We said the ulna is always on the medial side, right? This bone of the forearm is always on the medial. If you look here, you see that how these two are going to fit in this area, and when these are moving over each other, you see there is a space here over this lower part of the humerus that this upper part of the ulna can fit into that, even in the most straight position of these two. When we are bending, again on the other end, there is a space that this lower part of this part of ulna can fit into that. So these are the ones that we are using to recognize which side is anterior, which side is posterior. If you look at here, this is the way that the elbow is bending. Is your elbow bending toward the anterior or posterior? Bending toward the anterior, right? Hopefully you cannot bend your elbow toward the posterior, right? So this is the anterior view of the bone, right? And this other side is the posterior view. If you look at that, here you have a big fossa here. And here, so that was the posterior view. You have one big fossa here. It is the posterior view. On the anterior view, you have two small fossa. So this is the anterior side. This is the posterior side. We are going to go over the naming of this one, but just right now regarding the directions, this was the superior and the medial, so it could be here and it could be here. Now you know that this is the posterior, this is the anterior, so stick to one of them. Like imagine, always know that the bigger one is posterior, so this should be posterior. So if I put it like this way, is not correct, it should be posterior, but now, so this is posterior, but now this is lateral, it doesn't work. So if I put it here, this is posterior, and this is the superior and medial, so this belongs to the right side, right? Now regarding the naming, let's use this ulna, go over some naming of the ulna, then get back to the lower part, distal part of the humerus. As you see here, in this C shape that we have, we call this part a notch, right? This is a notch that we call it trochlear notch. Trochlear notch because it's going to go over this part and act like a pulley, right? Like this one, right? So this trochlear notch is going over this side, and we call this part of the humerus, these two together, as trochlea. It acts like a condyle. You remember, condyle is one side of a bone that takes part in a joint, right? So this part is on the side of the ulna, and ulna is always on the medial side. So this trochlea is on the medial side, right? Now considering that one, you see another part of the bone here that is a process or tubercle, right? This is the one that the muscles are going to attach to that, right? This is the one, so we call this one condyle, trochlea. This one is called epicondyle, above the condyle. And as this is over the medial side, we call it medial epicondyle. This one is also very clear and big and recognizable. Even with this one, you can talk about the medial and lateral, besides the fact that this medial side is always on the medial side, that is the head side here, right? So this is the medial epicondyle. Next to that, you have trochlear, and then next to that, on the lateral side, you have the capitulum. So capitulum, this is the another part that's going to take part in a joint with the radius, with this part of the radius that is going over that one and make a joint on the lateral. Remember, radius is always on the lateral side, right? Now you know the medial epicondyle, you know trochlear, and you know the capitulum, right? And that the best way to naming these ones is just go with the medial and the lateral. This is medial, therefore this is medial. This is medial epicondyle, this is trochlear on the medial side, and this is capitulum on the lateral side, right? Now regarding the three fossa that we have here, two small on the anterior side, one big on the posterior side, right? So as you saw here that this big one belongs to this part of the ulna. This part, this big part on the top of the ulna is called olecranon. The whole process here is called olecranon here, right? This part that is like a lower lip here, this is called the conoid. So we use this one to naming this fossa. This part that the olecranon is going to lodge into, we call this fossa as this big one single fossa at the posterior of the distal end of the humerus is called olecranon fossa, right? Then this part that the coronoid, if I said conoid, that was a mistake. Coronoid, this part of the ulna is going to go to the anterior. Remember, we close elbow toward the anterior side, right? So this small fossa that is toward the medial side is called coronoid fossa. So you have coronoid fossa and olecranon fossa. What about this other one? The other one that is the radius, we're going to make a joint here, and when the radius makes a joint with the capitulum here, when it gets close here, radius is going to go into that one. We call it radial fossa, the one that we have over the lateral side above the capitulum here, this one, this shallow fossa that we have. So that one covers all the things that we have, and also this was medial epicondyle, the other one here we have lateral epicondyle. Pay attention that below the medial epicondyle, that's the place that a nerve is passing. We call it ulnar nerve. This is the one that if this medial end of your elbow hits somewhere out, right, you feel that badly, you have a pain, a pinch of a nerve, don't repeat it, right? That because ulnar nerve here is very superficial because it's just passing under this medial epicondyle. So this area is for the passage of the ulnar nerve here. And when the nerve pinch, you just makes an action potential and then you feel it immediately badly, right? So you have all those things that I just discussed here. So you have the head here, lesser tubercle, greater tubercle, intertubercular sulcus here. Then you have the shaft, the hole here. And also here you have deltoid tuberosity, that is kind of a spiral, continues over there. And for the distal end, you have the medial side, medial epicondyle, you have the trochlea, these two together, and you have the capitulum. Above them, you have the coronoid fossa, and above this capitulum, you have radial fossa. And if we go over the other side, that is the posterior view, and you remember, you recognize posterior side by this olecranon fossa here. And you have the medial epicondyle, lateral epicondyle here, and that's all. And also you see that you have the surgical neck here, and you have the anatomical neck here in this one. So that was all about the humerus. That is the single bone that we have for the arm. Now for the forearm, we have two bones, ulna and radius. So let's continue talking about the ulna first. So again, you need to recognize the whole bone. And as we said, this C shape is very typical. You should not mistake it with anything else. And this is the proximal end, means the superior part of the bone. And the other end that you see, this is much smaller, right? And that's the distal end of the ulna. So for the proximal, as we thought, this is the olecranon part, the whole process that you have here. Then you have a trochlear notch here. You have a coronoid process here. And now, if you look at this and the way that the ulna and radius are going to attach to each other, it is this way when they are going to connect by this, right? So this, I'll show you the picture too. You see that here, that if it was rotated a little bit more, you could see that. So you're looking at the picture like from this posterior view. This is the olecranon, this is the coronoid, and here you see that the head of this disc shape of the radius is called the head of the radius. This head is, it has a joint or attachment with the ulna here, right? These two bones have 2 points of joint here, one in the proximal, one on the distal. So this proximal part, as you see, the head is going to join to the ulna. Therefore, on this side of the ulna, you have a notch. And as the head of the radius is going to lodge in this notch, we call this notch as the radial notch. So don't make a mistake between this radial notch that we have it on the side with the trochlear notch that is located here, right? Now, can you tell me which side of the ulna you have the radial notch? Is medial side or lateral side? Considering the fact that radius is attaching here. Can you tell me which side of the ulna is, let me ask it this way, which side of ulna is the lateral side? So the answer should be clear, right? Radius is always on the lateral, remember? Therefore, this side that the radius is going to attach should be the lateral side. The other side that there is no radial notch should be medial side, right? So that's one clue to recognize medial and lateral from each other in the ulna, right? So getting back to the ulna, so that is the radial notch. I wanted you to see that the way that you do not forget it. And then we have the ulnar tuberosity that if I can show to you. Let me see on the, yes, on this one, you see that here, that in this anterior view, below the conoid process here, you see the ulnar tuberosity, right? And also at the same time, as we have this picture here, you can see the radial tuberosity here. Later you see that each one of these tuberosity, as I mentioned, tuberosity is a rough surface, and that's a good place for the attachment of the muscles, right? So that was regarding the proximal end of the ulna. And for the distal structures that we have, we call this end of the ulna as the head of the ulna. So head of the ulna, as you see, is not this part, it's not this C shape. This is the other side, that is, although it's smaller, but that's the head of the ulna compared to the head of the radius, that the head is on the upper part of the radius. So this is the ulnar head, this end, and if you look, you have one process, one tiny process here that is coming out of that to one side, and that is a styloid process, ulnar styloid process. You have to mention ulnar to make sure that to emphasize that you know that is the ulnar bone, right? So this is the ulnar styloid process, and this one, the whole bone, is located always on the medial side. The same way is this styloid process. This styloid process is on the medial side of the bone. And if you look to this radial tuberosity, also you can emphasize that this radial tuberosity was on the lateral side of the bone, and this styloid process is on the medial side. And this styloid process, this is my thumb on the lateral side, and this is little finger on the medial side. This styloid process of the ulna can be felt here under the skin, because that's your side. That's very superficial. That's the one that you can touch it here. So that was regarding the ulna. We talked about the trochlear notch that pivots on the trochlea of the humerus. The head of the radius pivots in the radial notch of the ulna, and the ulna is medial to the radius. We all talked about this one. Now just know that we have one membrane, interosseous membrane. Inter means between. Osseous means bone. Interosseous means between bones. A membrane that is located between two bones. That's a fibrous sheet, means the fibrous connective tissue. You remember? Dense connective tissue between the ulna and radius. We go to the picture and you will see that how there is a membrane between these two. So before that, let's go over the structure of the radius, and then I'll show you the interosseous membrane, that is also called interosseous ligament because it's connecting bone to bone. And as we know, most of the ligaments of the body are from dense regular connective tissue because they're transferring the tension only in one direction. So for the radius, this is the radius. As you see, this is the proximal part, this is the distal part of that. And as you see, the distal part is bigger than the proximal. But the proximal end of that, it has a specific shape, a discoid shape, that is the head of the radius. Then you see that one part of the radius here, if you look from the side, and you can see that this is a tubercle, a big tubercle. We call it radial tubercle or radial tuberosity. You may see different naming for that. Just tubercle and tuberosity is consider that if it is a smaller, they call it tuberosity. If it is bigger, we call it tubercle. But you will see that these are using interchangeably in different books or by different people. But just go with them, whatever is in your book, you need to know that. And also here you have a neck here, right? Then on the distal part of that, Again, you see that one part of a bone, if you look, this is lower than the rest of that, and that is the one that we call it a styloid process, radial styloid process, this last lower part of that, right? Then you have the ulnar notch of the radius. That's the part of the radius that the lower part of the ulna is going to attach to that. So that is the place that the ulna is going to attach to the radius in the lower part, right? Now, let's go over the pictures. Before that, we talked about all these ones. Just let's emphasize the radius is lateral to the ulna. The head of the radius pivots on the capitulum of the humerus. These bones are parallel to each other in their anatomical positions. You remember, in anatomical positions, they are not rotating, because when we rotate the hand in the other way so that the palm of the hand goes toward the posterior, these two bones are rotating over each other, right? But in the anatomical position, they are parallel to each other. So we had this pronation and supination before. Now see how radius and ulna rotate over each other to make these ones happen. Pronation is when the radius crosses over the ulna. You remember? Radius is on the lateral side. So when you bring the thumb from the anterior toward the medial, so the radius crosses over the ulna. And supination is the rotating the bones so they are back in the anatomical position, right? So in this position, you are looking at the posterior view of the radius and ulna. You see all the parts that we discussed. You looking at the proximal, this is the olecranon from the posterior view, this is the head of the radius, and this is the neck of the radius, and here you see that next to here that you cannot see, that's the radial notch of the ulna, and you have a joint here, the proximal radio-ulnar joint, the joint between the radius and ulna, radio-ulnar joint. We call it proximal because it's on the upper end, and you have another one here between the radius and ulna, and haven't been shown here, but that's distal radio-ulnar joint. And the other things that you see here, you see the membrane here, interosseous membrane, they may call it interosseous ligament, both of them are correct. And on the distal end, you see the styloid process of the ulna, you see the styloid process of the radius, and you see this is the ulnar notch of the radius, that this radius is going to make a joint on that area. This is the distal radio-ulnar notch here. Pay attention that this lower part of the radius, that is bigger one, this part that is projected is toward the posterior side. If you ever need to recognize the side of the radius, I won't ask you this one, but if you ever want to know, this part is toward the posterior, because sometimes might become difficult for the radius to recognize it, but this is a good landmark, as this is on the posterior side of the radius. So that was all that we need to know from this one. And here you see them from the anterior view. We talked about the proximal part. Here you see the radial tuberosity here. As we said, the muscles like the biceps brachii is going to attach to this one. And on the distal, you see like all these surfaces that have been shown shiny, all those the ones that are going to make the joints with their wrist bones, with their carpal bones, therefore they call carpal articular surface. Now pay attention that the styloid process of the radius also can be felt here on the lateral side. So if you go here over the wrist, you can feel that the end of the radius here as the styloid process of that one. So we have talked about all this one: olecranon, trochlear notch, conoid process, radial notch, and this ulnar tuberosity toward the anterior side. So that was all about the radius and ulnar for the forearm. Now the things that has left, that we have the bones of the carpal bones. Here you have them all together, have been attached here. For the carpal bone, we have 8 bones that make the wrist, and they are coming in 2 rows, right? Proximal carpal bones that are closer to the shoulder or closer to the radius and ulna, and the distal carpal bones. And the best way to learn them is exactly like that. Divide them to 2 rows and go from the lateral side, that's the side of the thumb, toward the medial side for each row. And the joints between each carpal bone has limited sliding and twisting movement. They just like go over each other, slide over each other, very tiny amount, right? To make it easy to just move, not much of movement. So the proximal carpal bones are scaphoid, lunate, triquetrum, and pisiform. So as you start from the side of the thumb, that is scaphoid, lunate, triquetrum, scaphoid here, oh sorry, that's the proximal one. So we have the scaphoid, lunate. If you look at the side of the lunate, you will see that is a C shape like a moon. Lunar means like moon, right? Lunate is a C shape, has a C shape on this joint side of that, we call it lunate. Then we have triquetrum, and then finally this pisiform is the tiny small bone over there that we may talk about that what kind of bone is pisiform. Then the distal row that we have here, again from the side of the thumb, we have trapezium, then we have trapezoid, capitate, and hamate, right? So those are the lower row, those ones that you see. And also this hamate has this process, if you can see that from the side, that make it easier, that you can recognize. So here in this picture also you can see that after the radius and ulna you have these 8 bones. From the side of the thumb, that is on the side of the radius, scaphoid, lunate, triquetrum, and pisiform. You see the small bone is attached over that one. Then you have the trapezium, trapezoid, capitate, and hamate. And hamate is very clear because it has this hook over that one that is projecting toward the anterior. So those are so many mnemonic for this one. Just use whichever works for you so that you do not mistake them. Then you see after these ones we have the metacarpal bones, the long bones that we have here, and starting from the side of the radius and the side of the thumb, we start numbering them 1, 2, 3, 4, 5, right? So metacarpal, there are 5 metacarpals, number 1 to 5. 1 is the side of the thumb, and metacarpal associated with the pollex is number 1. You remember pollex is the thumb, right? And phalanges that we already discussed, that we have 14 phalanges in each hand, labeled as proximal, middle, and distal, because 4 of the fingers have 3, so it becomes 12, and the thumb has 2, becomes 14. Pollex only has 2 phalanges labeled as proximal and distal. As you see all the metacarpals here, and also you see the proximal and distal phalanx of the thumb, proximal, middle, and distal of all the other ones. So that was regarding the upper limb and the shoulder girder. So in the next video, we're going to cover the lower limb and the pelvic girder. Right? Good time.